from the tip of the nose to the earlobe. Tip of the nose to the earlobe. And we're going to follow that normal curvature of the nasal cavity. So when we're measuring, we let that curve follow the normal curvature of the nasal cavity. We're going to assess for what we think is the largest, most patent nares, and that's the one we're going to insert the airway into. The next thing we want to do, once we determine that, is we're going to lubricate the airway, and we're going to use a water-soluble lubricant. Sometimes you'll see them use a viscous lidocaine as a lubricant, and that also provides a little anesthetic effect in their nasal cavity. Because think about having this put down your nose. Okay, it can be very uncomfortable. So, but regardless, you're going to have some type of lubricant applied so that it can be inserted without causing a lot of trauma. Okay? So now what we're going to do, we're going to hyperextend the head, and I'm going to take my thumb and just gently push up on the nares so I can access it, and then I'm just going to take it, the airway, and slide it in. We're going to insert it gently, following the natural curvature. We don't want to force it. Nice and gently. Till we get that flange seated at the tip of the nose. And so that's the way it should look. Sometimes they'll take them, most of the time they don't. So once you get that in, if you needed to suction them, of course you're going to monitor it, but you could suction if you needed to. Once it's in, you can turn their head to facilitate drainage so that they're not just on their back and secretions are accumulating in that pharyngeal area. And then, I think that gets that. So, once we've inserted either one of those airways, we're going to assess their respiratory status and their oxygenation. So we want to assess their respiratory pattern, looking at their rate and rhythm and effort of respirations. We want to assess their O2 sat to make sure that, that their O2 sat is adequate. We want to assess their breath sounds to make sure they're bilateral and we hear good breath sounds. We want to make sure that the chest is expanding bilaterally. And then for the nasopharyngeal airway, we want to assess the condition of their nasal mucosa and their oral cavity mucosa. Because they may have their mouth open, and with the airway in, sometimes their mucosa gets dry, or they'll have some other secretions in there. So we want to make sure that we give them good care.